Hello everyone. Today, we're exploring the world of a natural remedy known as willow bark. As always, our discussions are intended for educational purposes. If you have health-related questions or concerns, it's essential to consult with a medical professional. Description: Willow bark, often referred to as the nature's aspirin, has been used for centuries as a remedy for pain and inflammation. Derived from the bark of willow trees, it contains salicin, a compound that the body can convert into salicylic acid, which has pain-relieving and anti-inflammatory properties. Historically, people chewed the bark or brewed it into teas to alleviate pain and reduce fevers. Today, willow bark is available in various forms, including capsules, tinctures, and topical applications. It's commonly used to treat headaches, osteoarthritis, and lower back pain. Warnings: while willow bark is a natural remedy, it's not without its precautions. It should not be given to children or adolescents with symptoms of the flu or chickenpox due to the risk of Reye's syndrome. Additionally, individuals allergic to aspirin or other salicylates should avoid willow bark. It's also worth noting that excessive consumption can lead to stomach upset or kidney inflammation. Before taking this remedy, before using willow bark, it's crucial to consider several factors. If you're allergic to aspirin or have a known sensitivity to salicylates, it's best to avoid this remedy. Those with conditions like asthma, diabetes, gout, gastritis, hemophilia, or stomach ulcer should exercise caution and discuss potential risks with their healthcare provider. If you're pregnant, planning a pregnancy, or breastfeeding, consulting with a healthcare professional is essential. It's also important to inform your doctor if you're on medications, especially anticoagulants, as willow bark might increase the risk of bleeding. Side effects: like all remedies, willow bark can have side effects. Some individuals might experience stomach upset, ulcers, or allergic reactions. There's also a potential for kidney inflammation with excessive use. Always be vigilant about potential side effects and consult your doctor if you experience any unusual symptoms. Interactions: willow bark might interact with other medications or supplements. It's crucial to inform your healthcare provider about all medications, supplements, and herbal products you're currently taking to prevent any adverse interactions. Specifically, those on anticoagulants, beta blockers, diuretics, or NSAIDs should be particularly cautious. Dosage: the correct dosage is essential for the effectiveness of any remedy. Always adhere to recommended dosages or consult with a healthcare provider. Typically, for pain relief, a daily dose of 240 mg standardized salicin is suggested. However, dosages can vary based on the form of willow bark and the specific ailment being treated. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid: while using willow bark, it's advisable to monitor for any signs of allergic reactions or stomach upset. Given its potential interactions, it's recommended to be cautious when combining willow bark with other medications, especially those mentioned earlier. FAQ: a common question about willow bark is its safety for long-term use. While it has been used for centuries, it's always best to consult with a healthcare provider for any specific queries related to this remedy, especially if considering prolonged use. Closing: that concludes our overview of willow bark. Remember, this information is meant to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.